Hi, I'm Caroline Newsome. I'm an attorney at Newsome Law. In this video, I will be discussing respiratory devices used for each level of locked-in syndrome. Locked-in syndrome is a devastating neurological condition caused by ventral pontine damage, often due to a stroke, trauma, or central pontine myelinolysis. With this condition, a person is fully awake and cognitively intact, but completely unable to move or speak. For most, eye movement remains as the only way to communicate with the outside world. Let's begin by discussing how respiratory failure is caused in locked-in syndrome. The medulla oblongata, located just below the pons, is the brainstem, serves as the body's breathing control center. It sends involuntary signals to breathing muscles, such as the diaphragm, through the phrenic nerves in the spinal cord. Damage anywhere along this pathway can result in respiratory failure. In cases where the phrenic nerves remain intact, spontaneous breathing can occur, but the breathing muscles may be weak or become fatigued, requiring respiratory support. Depending on the type of locked-in syndrome, incomplete, classic, or complete, respiratory care will depend on how damaged the muscles used for breathing are. Check out our video on types of locked-in syndrome for more information on these three types. Let's take a look at the three types of locked-in syndrome, how each one affects breathing, and the kinds of respiratory devices used to support patients with each type. Incomplete locked-in syndrome is the least severe condition within this diagnostic group, where people retain small voluntary movements, such as wiggling fingers and toes, as well as blinking. In most cases of incomplete locked-in syndrome, the medulla and the phrenic nerves remain intact. This means the person may be able to breathe on their own, however, the muscles may become weak. In this case, non-invasive respiratory support will be used. This means that there is no need for a ventilator tube to be placed in the trachea. For incomplete locked-in syndrome, the types of non-invasive respiratory support include CPAP, BiPAP, and a high-flow nasal cannula. The CPAP machine delivers a constant, steady pressure of air through a mask to keep the airways open. This is used intermittently, especially during sleep or mild respiratory weakness. A BiPAP, however, provides two pressure levels, higher during inhalation and lower during exhalation. This machine helps reduce the effort needed to breathe, making it more comfortable than a CPAP for some people. A BiPAP is usually in moderate breathing weakness or fatigue. Another respiratory device is a high-flow nasal cannula, which delivers warm, humidified oxygen or air through a nasal cannula at high flow rates. This is an option if respiratory muscles have retained some strength. The nasal cannula reduces the work of breathing while improving comfort and oxygen delivery. These devices can be used at home, making life safer and more comfortable for people living with incomplete locked-in syndrome. We'll now examine the second type of locked-in syndrome, classic locked-in syndrome, along with the respiratory support systems typically required for this condition. In cases of classic locked-in syndrome, all voluntary movement is lost, but eye movement remains intact. Similar to the incomplete type, the medulla and the phrenic nerves may be unharmed, but muscle weakness, pneumonia, or other complications after the initial brainstem injury may make breathing difficult. Many people with classic locked-in syndrome rely on mechanical ventilation, at least in the early stages. Mechanical ventilators are an invasive support where a tracheostomy, a surgically placed airway where a specialized device, a tracheostomy tube, is placed into the trachea just below the larynx to allow for mechanical ventilation and airway protection. This can deliver a full breath, control oxygen levels, and remove carbon dioxide when the patient's muscles cannot. In some cases of locked-in syndrome, patients lose the ability to breathe on their own because the brain can no longer send signals to the muscles that control breathing. However, if the phrenic nerves and the diaphragm muscles are still healthy, a device called a diaphragmatic pacer may be used to help. This device electrically stimulates the diaphragm using surgically placed electrodes, enabling natural contractions and potentially reducing ventilator dependence. Now let's turn to the last and most severe type, complete locked-in syndrome, and the respiratory device options available for these patients. Complete locked-in syndrome is the most severe form, where not even the eyes can move. In most cases, the medulla oblongata and the phrenic nerves are damaged, leaving the person unable to breathe on their own. They depend entirely on mechanical ventilation, sometimes for their life. For long-term management, trained caregivers also use humidifiers, suction systems, and cough assistance devices to prevent mucus buildup and infection. Without this device assistance, secretions can block the airway and cause pneumonia. These preventative measures are pivotal, as pneumonia is a leading cause of death for those with locked-in syndrome. Choosing the right respiratory support is more than just about prolonging life. It's about preserving dignity, safety, and comfort for people living with locked-in syndrome. If you or someone you know has been diagnosed with locked-in syndrome and have questions about medical care or legal rights, visit us at Newsome Law. We're here to help.